Joining us at the site of the FCC mHealth Conference and Expo is Ken Dix with Alere Connect. He's the President and Chief Executive Officer. What is Alere Connect?
So Alere Connect is used to be formerly known as MedApps out of Scottsdale, Arizona. We are a remote wireless remote patient monitoring solution to be able to put devices in patients' home to be able to monitor and keep them well and have better outcomes and keep them out of the hospital.
And so these devices depend on the cloud and spectrum to operate?
They do. And they have, inside of our device I'm going to show you today, they have wireless cellular technology using what's known as M2M technology.
Which is?
It's the kind of technology you find in your car, in your laptop, in the parking meters that are out there, very economical and sending a small amount of data to the cloud.
So walk us through a little demonstration of how this technology works.
So the device I'm going to show you first is our Mobile Link device. Now at Alere, we have point-of-care devices like for anticoagulation, for lipids, for A1C. We also do health management as well, health information exchange, analytics, the whole spectrum of care. But this device is an anticoagulation device to do PTINR readings. And typically, a patient that's on Coumadin or warfarin would have to go to their doctor maybe once a week to get a blood reading. My mom does that, to go to her doctor to make sure that her blood thinners are working properly. This device is produced by Alere, called the Ratio 2. It's in about 100,000 patients at home, and then the data goes into this device, and they can go to our service center, our nursing center, where they can help monitor the patient. If there's a problem, they can alert the patient's cardiologist on this. What we're trying to do, and what we are doing with this device, is now we are connecting it to our Mobile Link, which has M2M cellular technology, which I talked about. It connects via a wire to the device, and then once you take a reading, it'll send it automatically to the cloud using the cellular technology and into a back-end system where it can be monitored.
Like an iPad or some type of device?
Well, I've got this on an iPad, but we've got a system which we call the HealthCom 2 system out here where you can set thresholds for a patient. There's multiple systems we can put it into, but this is our HealthCom 2 system, which brings it in. It sets alerts to be able to go through and say, I want their reading to be between 1 and between 3, and if it gets outside that range, then I want to act upon it. So from an efficiency standpoint, a nurse that's looking at this can go through, and if I'm doing well, then there's really nothing she has to do with me today. But if I'm outside of ranges, then maybe an intervention needs to occur so I don't go into the hospital, so I don't have heavier healthcare costs.
So Ken Dix, you have another type of technology that they can talk to each other, and it's web-based. What's this device?
So this is our Home Link. This isn't FDA cleared yet. This is still under FDA review, so we're not selling this device yet. But this is a little bit more of a device to be able to talk to multiple devices around it. Somebody that has comorbidities, right? So scale, blood pressure, pulse oximeter, glucose devices, the type of glucose devices that a patient would have in their house anyway.
So how does it work?
So on this, if we would send this home with a patient and they're like a COPD patient, right? I've got a non-pulse oximeter here that's going to take oxygen saturation. Don't look at my stats because they're actually pretty poor today, right? But if you look at it, it'll go through and start looking. It's going to do a little bit of calculation, say what my oxygen saturation is, what my heart rate is, right? And then when this stops, it's going to send it over to this device, and it's going to, if you just put your speaker here.
Saturation is 94%, and your pulse is 107.
So if you left it alone for right now, it announced it's 94 of 107. If you left it alone, it would actually start asking the patient questions. And depending on what program the patient's in, I've got this in a diabetes program, it's going to start asking questions like, did you take your medication today? Did you exercise today? Has your blood glucose been over 300? Has your blood glucose been below 60? We want to look at those type of behavioral parameters to determine if the patient's having any type of problems and if we need to intervene.
So Ken Dix, for a company like yours, what do you look from the FCC or other forms of government as far as making this technology available?
Well, we've worked with them for the last 3 or 4 years. We were here when the FDA and the FCC initially handed off between Julius and between Margaret Hamburg to make it easier to be able to get through FDA, so we have the right patient safety, right, to be able to do that with these type of devices, but also from the FCC side to be able to bring the most amount of spectrum to rural and highly rural organizations and areas that are out there to try to get these devices in the patient's hands. And that's what the FCC is doing. They're allowing us to work with additional spectrums. They're allowing us to get things to market quicker through FCC certifications as well. One of the things that we are concerned about is the underserved population, as the chairwoman said this morning. I personally have testified for Veterans Affairs on rural and highly rural, activity for veterans. If you are a veteran or any person, any U.S. citizen living in a U.S. Area, and it's in a rural area, and it's 3 to 5 hours away from your physician, you're going to tend to exacerbate the disease, make it worse. The next time you present, it's probably going to maybe be in the hospital, and it's going to be a higher healthcare cost. So we want to try to put this technology into place to be able to monitor people that are an indigent population, an elderly population, a rural population, the population that is consuming 15% of the healthcare costs, that consumes 80%. That's what we want to target to keep them out of the hospital.
Kent Dix, the President and Chief Executive Officer of Alere Connect. Thank you.
Thanks so much. Appreciate it.